Now, what is the influence of, or how can you make things faster or slower? One thing you should know is the funny current, this HCN channel, is blocked by a drug called ivabradine. Ivabradine, Ivabradine. So ivabradine slows the heart rate. This is given in people who have heart conditions where you want to slow down the heart, so the oxygen consumption of the heart is not so high, because the faster your heart beats, the more is the oxygen demand on the heart. It's one of the most important factors that determines oxygen consumption of the heart. So ivabradine is able to slow down your heart rate by blocking these sodium channels. And so what happens is when you give ivabradine, you see there's a certain rate with which this funny current is reaching the firing level. Okay, so let's say this is the firing level over here, and this is the funny current, and it takes its time. Now what happens when you give ivabradine? This line becomes even more slow. It's not so steep, so you take a longer time to reach the firing level over here. Okay, so that's going to initiate the heart rate much slower. Ivabradine is when you give it to the patient. Remember, these funny currents are not just located only in the heart, also they are located in your retina, in the rods and cones of the eye, so it will affect your vision also. Just be aware of that. Okay, so they found out that ivabradine helps people with angina, where you get chest pain because of lack of oxygen to your heart from coronary artery disease, blockage with atherosclerosis of your coronary vessels, and in heart failure patients. So if you give them ivabradine, this is a very good treatment, along with many other medicines which these patients will be on also. Okay, so here ivabradine blocks this. Just be aware of this. Now, what are the other things that have an effect on your pacemakers? Well, the sympathetic nervous system, and parasympathetic, the autonomic nervous system. So see, this in black over here is the normal rate at which your pacemaker was firing, your SA node was firing, for example. Now, if you activate the sympathetic nerves, fight or flight response, when you're scared or when you're ready for a fight or you're angry or whatever, point is you're going to these sympathetic nerves will supply the heart, and they also supply so the beta 1 receptors on your heart, which are present in the SA node. They release norepinephrine as the neurotransmitter on this tissue. So here's your heart, here's your SA node, you have the nerves going over here, and they release norepinephrine, and norepinephrine is going to work on these beta 1 receptors in the SA node, in the nodal tissue, and that is going to increase CAMP levels. Again, norepinephrine G protein coupled effects. I'm going to have a class on that soon. This is going to activate the funny currents, the pacemaker currents. They will work much faster. So see, here in the black, it is having a certain amount of slow, but when you activate sympathetic, you see how steep this angle has become. What should have been taking a longer time to reach firing level, instead we get this red action potential much faster, because the funny current is much steeper, the slope is much steeper. And also it will cause the earlier opening of the L-type channels, in phase 0, and cause an increase in the heart rate, because you've reached the firing level much faster due to sympathetic stimulation. In parasympathetic stimulation, you have over here, you activate the vagus nerve, which also supplies your nodal tissue, which I'm drawing in green. So when you activate the parasympathetic nerves during rest digest stages, what's going to happen is you will get vagal stimulation, and that is going to cause a release of acetylcholine. So for parasympathetic, we release acetylcholine as the neurotransmitter. That will bind to M2 receptors, which are also located in the pacemaker tissue. They are specific for the acetylcholine, and then what will happen is the acetylcholine will bind to it, and it will reduce CAMP levels and do the opposite effect. It will reduce the slope of the funny current, or the phase 4. So this will cause a reduction in the heart rate because it does not reach the firing level. So that is your pacemaker potential, but there are some more points which can affect your pacemaker potential, especially the rate at which it works. One is the temperature. If you increase the body temperature, like in fever or exercise, for example, you will be able to get this slope much higher, as if you did sympathetic activation. It mimics that. So fevers will increase the heart rate. Every 1 degree Celsius rise in temperature, every 1 degree Celsius rise in temperature will cause an increase in your heart rate by 10 beats per minute. It will rise by that. So let's say you are 37 degrees Celsius. Your normal temperature is 36.6 to 37.2 degrees Celsius. Now let's say you have an average 37 degrees Celsius and your heart rate around 70 beats per minute. So what happens is, if you get a fever, then your temperature rises to 38 degrees Celsius. Now guess what your heart rate is going to be? 80 beats per minute. This is what happens in fever, and when your body temperature rises. There is an exception, which is typhoid fever. Typhoid will not have an increase in your heart rate. Typhoid fever is where you will get bradycardia. C-A-R-D-I-A. So this is the infection by Salmonella typhi. You get it from eating unhygienic food, unwashed vegetables and fruits, and food which is not prepared with clean hands. It's spread from the fecal-oral route. So someone's stools into your plate, somehow it comes in and you get infected. Maybe from not washing hands or not using clean sources of food, not hygienic sources of food. And there are other things. Thyroid hormones, again, they're as good as saying increase in norepinephrine levels in the blood, sympathetic activity. So they increase the rate of SA node firing also. So thyroid hormone increases SA node activity. And then what about bile salts? So bile salts, they're present in the gallbladder, and they get excreted into your gut, into your duodenum, whenever you eat food, especially fatty food. Well, supposing you have a stone and it blocks this duct which has the bile salts. So this bile salt is now going to go back into the blood, and it's going to circulate in the blood, and this is going to slow down your heart. That's why these people with obstructive jaundice, they get jaundice because bilirubin is also present in this gallbladder. It goes back into the blood, so they get high levels of bilirubin, and it'll be a greenish type of hue, not a yellowish hue as much as a slightly greenish hue. So because you got some biliverdin and bile salts, and this bile salt will go into the blood, go to the heart, and slow down everything. And also the bile salts will stick in the skin, and the person gets really itchy skin in these obstructive jaundice people here. Okay, and other things that slow down the heart rate are beta blockers. They will block these channels over here which you studied about, the beta 1 receptors. They get blocked by beta blockers like propranolol, metoprolol, and that'll slow down your heart rate. Even there are some calcium channel blockers that slow down the heart rate, which are nodal specific, like diltiazem, Tiazem, diltiazem, and verapamil. Especially diltiazem and verapamil, they're the ones that work on node. Not amlodipine, nicardipine, nimodipine, those drugs with the word dipine at the end, those don't work too much on the SA node. They might actually cause a reflex tachycardia in some situations. Then you have digitalis also. Digitalis is a drug that blocks sodium potassium ATPase pump, and they also slow down the heart rate because they have a parasympathomimetic effect. They mimic having increased parasympathetic activity in the body. Right, so this is your pacemaker potential. Very important to understand. Okay, and the slope is very important over here. Right, so here's your picture, your notes made nicely for you. Gets you to understand that from minus 50 we are going to plus 10. Firing level is at minus 40 millivolts, and it's not so steep. You could see these lines. They're not as steep as the pacemaker, as the cardiac muscle, which is very sharp upward over there. Okay, so this is your pacemaker, Karak.